Is that countering as we sort of lock down our community?
We're experiencing no problems. It's business as usual. The city's open for business. Police department is, as always, effective out here, doing our part to protect our community and our citizens. And calls for service are about the same. We're trying to direct as many calls as possible to our front desk. Non-priority calls, thefts, stuff like that, minor stuff that can be taken here at the front desk instead of officers having to go out to the house and possibly get exposed to anything. So it's working out pretty good. We've beefed up our staff on the front desk, and we have no issues or no problems or no complaints right now.
Chief, what's your message? The bars,
Excuse me.
the restaurants? Are you actually actively patrolling?
Well, yes, we are actually working with the ABT, the State Alcohol, Beverage, and Tobacco Agents. They are here. We're teamed up with them, paired up with them, and we're checking all the bars to follow the governor's mandate as far as all bars have to be closed. We've had probably one or two locations that are kind of questionable as far as the licenses. Does it qualify for a restaurant or whatnot? ABT's working that out. They're actually going to come in tonight at 7 o'clock and address those 2 or 3 places. But I'm proud to say we're getting, like 90%, 98% compliance from all the bars. Everybody kind of gets the big picture here. The faster we, can shut things down and avoid exposure with people, coming in contact with each other, the quicker we can get on with our normal lives here in the United States. So I think everything's working out pretty good. I'm very proud of it.
Chief, Florida's become sort of a network, a national story now with everyone packing the beaches amid coronavirus. What's your message when you see a ton of people out on the beaches kind of...
Well, I'm not a medical doctor. I think sometimes on the news there's a lot of stuff comes out that the news doesn't even know about. They just put it out. Sometimes it scares people. So I mean, why take the chance? Be safe. Separate yourselves. Distance yourselves. You shouldn't be in large groups. I think they're saying 10 people. The CDC's recommending 10 people. From what I'm hearing, it's good to be out in the sun. It's good to have the salt air is what I'm reading. Things I've read. But you don't need to be all on top of each other. We have a huge beach that runs on our I think it's like 17 or 18 miles here in Volusia County. And I don't think there's that many people going to the beach, is from what I'm being told. So, I mean, just spread out and space yourselves. I mean, I don't know.
Are you guys patrolling the beaches?
No, the beach is the jurisdiction of the Volusia County Beach Patrol. We got enough problems here in Daytona Beach to deal with. Anything else?
You feel confident your officers are well equipped, et cetera,
Well, the most important thing is the health and safety of not only our officers, but the citizens and the public at also. So 3 weeks ago, we already started putting in a plan in place with adding more dispensers for the hand sanitizer and sending out emails to stress that, hey, wash your hands, keep your hands away from your face. Like I said, I'm not a doctor, but from what I'm hearing with this, it only can be, it's not in the air, it's not airborne, if you want to say that, but if you touch somebody or you touch your face and you touch a surface, you can contract it. So as long as you keep your distance, wash your hands. And one thing about law enforcement, we deal with some nasty, dirty stuff sometimes. So we constantly always wash our hands. We have hand sanitizer in our car all the time. So we kind of been practicing those habits for a long time. But, I feel confident in everything we've done so far that number one, our employees are safe, our officers, our civilian employees, and the public at best. I'm getting an overwhelming positive feeling here in Daytona Beach that people are taking these concerns serious, and they're actually enacting some of those parts. So the only thing I ask is people stop hoarding stuff. What's this with the toilet paper? I don't know. It seems like there's no toilet paper on the shelves. I don't know how that relates to the coronavirus. I don't know. But be cognizant of the fact that we have other citizens here and the people that need stuff. So it's not the end of the world. So, just if we all work together as a team, come together, we'll be able to beat this and move on. I mean, we're Americans. We got a fighting spirit here. We're going to get together and we're going to beat this virus, and we're going to move on with our lives. And we're going to learn something from this, if anything. I think we're going to definitely learn. We're learning a lot of things as a police department on strategies and tactics in case this does happen again. So I feel very confident this thing will go away, and we'll learn from it.
You touched on this a little bit already, but I know some emergency responders are taking extra precautions because the vulnerability, if one guy becomes infected, it's like you have to put an entire group out if he's come in contact.
Well, like I said, I'm not a doctor again, but that's what I hear. But then again, I'm hearing this thing affects people different ways. I've been doing a lot of research and reading up on this, and I can tell you might have it and might have the effects of a common cold. I might have it and have nothing. But, you don't want to spread it to the population that's very vulnerable. If they're saying the elderly, people that have pre-existing medical conditions, and stuff like that. So you got to be responsible for yourself. It starts there, and stop spreading, trying to spread it and contract it. we're checking all our employees to make sure they're okay. If somebody even feels sick, we're sending them home. We're asking them not to come in. Nobody's losing any kind of pay or anything like that. We got to use common sense here. And common sense starts that, in this profession as first responders, we're used to dealing with different types of diseases and viruses and dealing with some dirty things and nasty things. So we're constantly in that operations of constantly washing our hands and cleaning ourselves. I mean, I don't think there's going to be any kind of issues with that because, I mean, we've been preparing for this throughout our careers as far as washing our hands and keeping our hands clean, using gloves, using masks and whatnot. So I feel very comfortable. It's the public, non-law enforcement, non-first responders that need to understand these things. And I think people are taking it serious because if you put on the TV and you see what's going on the internet, this is a real serious problem. Is it the end of the world? No. Is it something we can get through? Yes. Is it something that we have to work together as a team and make sure everybody coordinates their efforts and follows the same kind of plan as far as keeping distance, not exposing yourself to any potential kind of disease? I think that's the only way we're gonna stop it. And from what I'm reading, in China, there's been no more new cases. So that's a positive sign to me that, okay, if a couple months, maybe we can get through this thing and they'll come up with some kind of vaccination for the future. And I think as Americans, we have that fighting spirit, and we're gonna do what we can to, number one, take care of ourselves as a country, take care of our people, everybody working together. And I think there's going to be some good that comes out of it. I'm very sorry for these tragic deaths. I hate to see anybody die from anything, let alone a disease. But I think you got to look at this in history and how we're going to react to this and how we're going to learn for future viruses that come out. So,
any message to the spring breakers, too, guys? Any message to the spring breakers? You got a lot of millennials coming here to enjoy the beaches.
Yeah.
Daytona Beach is a hot destination.
Yeah, it was years ago, but we're not seeing the numbers we used to see. And, from what I'm seeing and looking right now, there's not that many spring breakers here. I mean, I recommend you go back home and just work with us and stop congregating and stop, think a little bit. But, you can't control people's movements. This is America. We can't, we got to be very careful where we balance the health concerns with people's civil rights. And I think the right thing to do is do what everybody else is doing. Keep the crowd numbers down to 10 people. Follow the rules. If we do this all together, we're going to beat this. We're going to beat it regardless, but let's beat it faster so we get back to normal here. We get this economy going again, and people don't have to worry because there's some very scared people right now. Not so much, I don't think, I think, yes, a part of it is getting the virus, but a lot of it's, what about my finances? We're a service industry town here. People are bartenders, our waitresses. They count on this money to survive, and now they're not able to go to work. So I think people more fear that than so much as catching a virus, because if you catch it, I don't know. I don't want nobody to catch it, but if you catch it, you know what you need to do: isolate, and there's no cure. But I think at the end of the day, we're going to learn a lot from this, and I think Florida is going to be okay. I pray for some of these other cities, major cities like San Francisco, what they're going through, Los Angeles, New York, Chicago. I mean, the whole city of Chicago is completely shut down. I think LA shut down, New York shut down. But at the end of the day, you got to shut these things down to let this thing play itself out and move on. But I'm not really worried about spring breakers. We're not seeing the numbers we used to see. And I think a lot of them have left already. The bars are being compliant. All the big nightclubs have definitely been in compliance since I think it was Tuesday night. They have shut down. So there's nowhere to go. Now, some of the restaurants that are open have the seating space. We've checked them. We're checking for compliance with the 50% capacity. And we're wired like that as first responders. We're always looking for, public safety and what can we do. So we're kind of been trained for this and conditioned for it, mentally, physically, and spirits are up here, and we're taking preventive measures just to avoid getting any kind of exposure. That's the best way to put it.
Are you doing anything to keep the jail population down?
I'll refer that to the Volusia County Branch Jail and the State Corrections. I know Director Flowers personally, and he's on top of some things already. We've talked, and they do a great job out there. The right people are in the right place in these positions, so I'm sure they're following all the protocols.
Have you guys talked about emergency testing for your officers?
I know that there's a shortage of tests and stuff and whatnot. Then I read that they flew 500,000 over from Italy, so I'm sure the tests will start coming. And I am very confident in the leadership, not only in this city, very confident in the leadership of the city, but also on the state level and on the national level with the president. They're doing the right thing. They're on top of it. Nobody knows what to expect. We're in new territory here. We're in an area that we've never experienced, as I think in our generation, as Americans of what's going on here. So I praise the president for what he's doing. I praise our governor. I praise our mayor for being bold enough to go out there and say, no, enough's enough. Public health and public safety comes before the economy, and it does. So we'll beat this. We're going to beat it. I feel very confident in that, and we'll move on from there. And then we'll learn from this. You got to learn from this. History tells us, a lot of things. So you got to really look at that and say, how do we handle this situation? Because we're going to be judged on it for the next one. There's going to be something else that comes on. But it's the American spirit, the American will to succeed. Life will go on, and we'll get better for this. And I think one thing we're learning is people are really, it's like going back to the old days when I was a kid. There was no cable TV. There was no, really video games. And we were outside playing football and running around. So I got my kids out there playing football, playing golf, playing basketball, getting outside. And I think that there's some good that comes out of this. Unfortunately, there's been a lot of deaths, way too many deaths associated with this virus. And I wish that that didn't happen. I don't wish that happened on anybody. But City of Daytona Beach, I can tell you right now, dedicated, committed employees that are out here to protect this city, keep the community safe, and they're working hard 24/7 to do that in a safe manner. But we're not going to take any shortcuts when it comes to our citizens, our visitors, and number one, our employees and our officers.
Chief, I'm getting some questions on social
Yes,
media
sir.
about the bingo halls, dog racing areas, stuff like that. Any special concerns?
Yeah, well, I talked with the dog track, and they are in compliance based on state statute of as far as it being a restaurant. They have reduced their seating capacity by 50%. There was some complaints about stuff in the card room. They're looking at that. They're mandated by some kind of state gaming commission, and they're waiting for direction from the governor on that, I was told. We heard about a bingo hall. We're going to go there and check it out tonight. I don't know how much we can enforce there, but we're going to recommend, hey, can you please maybe shut this down and break it up, because you have potential to have a couple hundred people in a location. That's the preferred method. We recommend that you do that. I can't, force people to do that stuff. So we're on top of it. We're investigating every complaint that comes in. We're on top of it. And you know what? 90% of the time we're getting compliance. You're going to always have that 10% that's going to try to, buck the system and have their own opinions. But I think when you explain it to them and talk to them, they kind of get it. And can't please everybody. Okay. Thank you.